Good afternoon. Good afternoon, everyone, and welcome to our seminar from Adversity to Empowerment, Global Perspectives on the LGBT Community and Substance Use Challenge from a Human Rights Perspective. I want to begin by expressing my deepest gratitude to our incredible panelists for their time, dedication, and unwavering commitment to this vital issue. Their work is nothing short of inspirational, and we are fortunate to have such expertise with us today. I will also like to thank our translator, who will be helping us to switch between English and Spanish. So if you wish to access the translation, simply please click on the interpretation button at the bottom of your screen and choose your language preference. En español lo diré también porque si alguien desea acceder a la traducción, por favor,
I will
simplemente que
also
clique
say
en el
this in
botón de
Spanish. If you
interpretación, que lo
want
pueden
to listen to
encontrar
the
en
translation,
la
simply click
cajita
on the
al final,
interpretation button at the bottom of
y
your
pueden
screen
poner
and
de
choose
preferencia el
your
idioma de
language
castellano.
preference.
So this seminar brings together voices and perspectives from various parts of the world, making it truly a global conversation. We have honored to have participants from different countries and regions, each contributing unique insights into the challenge faced by LGBTQ+ communities, individuals, regarding substance use and access to healthcare as well. This global representation not only highlights the universality of the issues, but also emphasizes that the solutions we discuss today must consider diversity, cultural, legal, and social context. As we explore these issues, we will touch on a broad range of topics, including research, prevention, treatment, legal service support, harm reduction, and community intervention as well. This is not just a discussion of our challenges. It is a call to action rooted in human rights, the right to health, the right to dignity, and the right to exist free from discrimination and violence. The global LGBTQ+ community continues facing barriers to essential health services, often exacerbated by stigma and exclusion. And we are here today to listen, to learn, and to share strategies that can turn adversity into a pathway to empowerment. Before we begin, I would like to encourage everyone to introduce themselves in the chat box. If you can see the chat box, you can introduce yourself there if you feel like, by sharing your name, organization, and country, so we can just build a little bit more network between each others. And this seminar will be recorded. For anyone who would like a certificate of participation, please feel free to request one using the link provided in the chat box just 1 minute ago. Through these presentations, feel free to reflect to any thoughts or idea that come on in the chat. And if you have very specific questions for our speakers, you can submit them on the Q&A chat box, and we will address them during the Q&A session. As your moderator, I will be switching between Spanish and English at times. Please remember to choose, again, the channel that works best for you, whether it's the original language or the English or Spanish. So the methodology for today is straightforward. We will first hear from our distinguished panelists who will share their essential forward-thinking ideas. And this presentation will provide us wealth of knowledge and fresh perspectives, paving the way for meaningful reflection and a deeper conversation afterwards. After the presentations, we will transition to a roundtable discussions where the panelists will engage with your questions and discuss in greater depth. So please feel free to add in the Q&A box. Thank you once again for being here today. Your participation in this global dialogue is not just appreciated, it is crucial to our collective effort to improve the health and well-being of LGBT communities worldwide. So first and foremost, let me give a warm welcome to all the panelists joining us today. So good morning, Edward, and good morning, Xochitl, and good afternoon, Laia, Christiana, and Marqueta. And good night, Christian. This is a really global conversation. There's timetable all around the globe. And thank you all for being with us today. So now let's move on to the first presentation so we can dive into what really everyone is eager to hear. So I'm going to switch to Spanish right now. Nuestra primera panelista, nos complace enormemente presentar Laia Plaza Hernández.
We are pleased to introduce Laia
Una
Plaza
investigadora
Hernández,
de
a dedicated
representante de la
researcher
Fundación
focused
Salud
on
y
the
Comunidad.
intersection of
Perdone un
LGBTIQ
segundo que...
plus rights and drug services in Europe. One moment, please.
Un segundo, Laia es investigadora de la
As I
Fundación
say,
Salud y
she's a
Comunidad.
researcher
Ella es
at the
de
Salud y
formación
Comunidad
antropóloga, es
Foundation.
psicóloga
She's an
social,
anthropologist, social
es
psychologist,
consultora, es una
consultant,
investigadora con perspectiva
and
interseccional y
a researcher
feminista,
with an intersectional view,
cuyas obras
feminist
son
view. Her works
imprescindibles en
are
la lectura,
essential
y
reading,
tenemos el gran placer
and
de
it is
escuchar
a
a
pleasure for
Laia
us to
hoy,
listen to her
sobre
today.
todo que nos va a hablar
And she
de
will
la
speak to us
investigación, desde el punto de vista de la
about
investigación.
research from a research
Su
standpoint,
presentación
and
se va a basar
her
en la perspectiva
presentation is based on
LGBTIQ+,
the
en los servicios de drogas europeos,
LGBTIQ
dos
plus
estudios
perspective in European
recientes.
drug services, two
Como
recent
sabéis, su
studies.
trabajo ha
As you
puesto de
know,
manifiesto brechas
her
críticas en la
work
atención a las
shows
necesidades
critical
de las
gaps
comunidades,
in
con un
the
enfoque especial en la
needs
violencia
or care
institucional
in these
y en los
communities,
desafíos para
focusing on
reconocerla y
institutional
abordarla
violence
dentro de los
and the
servicios de
challenges to
drogas.
recognize it in
Entonces,
drug
tenemos
services.
muchas ganas de
So we
escuchar
are very
sobre
anxious
violencia
to
institucional
hear from
y
her about
investigación con
institutional
perspectiva feminista.
violence
Muchísimas
and
gracias,
this
Laia, por
feminist
estar con nosotros.
based research activity that she's involved in. Thank
Hello,
you, Laia.
everyone.
May you take the floor.
First, thanks to Gisela and Dianova for having me. I'm delighted to be here and eager to hear from the other panelists. Since we have simultaneous translation today, I'm going to switch to Spanish right now so I can feel more freely. Okay. Vale. Vale, pues a mí me apetecía presentaros un par de
Today, I'm going to
investigaciones
present
recientes
some recent
europeas
research projects at the
que
European
abordan de
level
forma más o menos
that
explícita la
address
implementación de la
specifically
perspectiva
the
LGTBI
implementation
en
of
los
an
servicios de
LGBTI
drogas y luego apuntar
perspective
algunas
in drug
recomendaciones que de hecho se
services and
desprenden
some
de
recommendations that have
ambos
been derived
estudios.
from these studies.
La primera fue una investigación que
The
impulsamos desde
first
la Fundación
research
Salud y
project that
Comunidad
we
en el
promoted
marco de
from
un
the Salud
proyecto
y
financiado por
Comunidad
la Comisión
Foundation,
Europea.
a project that was
Se desarrolló
funded
en 6
by
países de
the
la Unión
European
Europea y
Commission
tenía
in
como
6 countries
objetivo
of the
comprender mejor
EU.
las
The
violencias
goal was
machistas
to understand better
experimentadas por
the
las mujeres que
male
usan drogas,
violence
así
experienced
como
by
mapear
drug
buenas y malas
using,
prácticas
consuming women
en los
and to
distintos
identify the
servicios
best
de drogas.
practices
Por tanto, no
in
ponía tanto
the
el
different
foco
drug services.
en
So the
mujeres que usan
focal point
drogas
was not so
diversas,
much on
pero
the
sí que
diverse
obtuvimos algunos
group
resultados
of
interesantes al
drug users,
respecto.
but we did get some interesting
Un
results
primer dato
from the
es que
study.
la muestra estaba
First of all,
compuesta por un
the
25%
sample
de
was made
mujeres
up
que usan drogas con
95%
orientaciones
women
sexuales diversas
of
y de
drug
estas
users
el
with different
50%
sexual
dijo
backgrounds. Of them,
que se había
3%
sentido
said that
discriminada alguna vez en
25%
la
that
vida
they
por su orientación
had,
sexual,
excuse me,
además
50% that they
de
had
por
felt
ser
sexually
mujeres
discriminated at some
y
point in
usar
their lives,
drogas.
in
Por
addition to
tanto,
being
vemos
women
aquí
and
ya la
drug
triple
users.
discriminación.
So we see a triple discrimination in this case.
Cuando preguntamos sobre las
When
violencias
we
machistas
asked about
experimentadas a lo largo de la
male
vida, nos sorprendía
sexist
este
violence throughout their lives,
35% de
we
violencia
were
institucional en
surprised to find
distintos
that
tipos de
35% of the
servicios,
institutional violence
servicios
had occurred
sanitarios,
in different
sociales, de protección de
services,
la
health
infancia,
services, social
judiciales,
services, childhood
policiales,
services,
etcétera, y
police
también en servicios de drogas,
departments, and also
como es
in
el
drug
caso de
centers,
estas dos
as was the
mujeres
case
en
of these two
relación a su
women with
orientación
regard to their
sexual.
sexual orientation.
La violencia institucional, como sabéis, ha
Institutional
sido
violence, as
reconocida
you
por
know, has
múltiples
been
convenciones y
recognized in
declaraciones
different
internacionales a lo largo de la
international
historia,
conventions and
que define
declarations
como la
throughout
violencia
history. It's
perpetrada por el
defined
Estado o por
as
terceros
violence
actuando en
perpetrated
nombre del
by the
Estado, tal y
state
como
or third
señala el
parties acting
Convenio
on
de
behalf of
Estambul,
the state.
lo que incluiría tanto
And this
servicios públicos como
includes
privados
public
con financiación
services
pública,
and publicly
como sería el
financed
caso de
private
muchas
services, as the
ONGs del
case of many
ámbito de las drogas, por
NGOs
ejemplo.
from drug services, the drug service
El
sector, for
estudio,
example.
interesantemente, relaciona
Interestingly
las
enough, the study
violencias
related
institucionales en servicios de
institutional
drogas
violence in
con
drug
los
centers
tipos de
with
enfoques de los servicios,
the way
ya que
the
vimos que
centers
solo una cuarta parte de
design
profesionales decía
their
trabajar desde
outlook.
una
Only
perspectiva de género
24% of the
interseccional
professionals
o desde un enfoque
said that they work from a
orientado al trauma. De hecho, la mayoría de
sexual orientation
profesionales
intersection
afirmaron
standpoint,
trabajar desde
and
un enfoque
26% worked from a
biopsicosocial, que por lo que
trauma-oriented
vimos en las entrevistas de
focus.
grupos focales
Most of them worked
no
in
incorporaba estos dos
a
enfoques.
psychosocial
Además, solo el 35% de las
standpoint,
mujeres
and only
decía que la
35% of the women
diversidad
said that
era tenida
diversity
en cuenta
had
en los
been taken
servicios
into
en los
account
que se
in the
encontraban
services that they
y
had
solo,
used, and
sin embargo, solo el
yet only
15% de
15% of the
profesionales decían que
professionals
la
said that
atención a la diversidad
that the
debía ser
attention to
mejorada en
diversity
los servicios en los que
needed to be
trabajaban. Por tanto,
improved in the
vemos
centers where
un
they
gap
worked.
entre la
Therefore, there is
percepción
a
de
gap
mujeres
between the
y
perception of the
profesionales
women
encuestados.
users of these services and the professionals working
La
there.
investigación también relacionaba
The
los
research
tipos de
project also
violencias
related
institucionales
types of
encontrados en
institutional
servicios de drogas
violence
con
found in
los
drug
tipos de
centers
estructuras de
with
las
the types of
organizaciones que formaron
structures that
parte
those
del
organizations
estudio.
had, those that were studied.
Básicamente eran
They
estructuras
were basically
que denominamos cis
structures
heteropatriarcales.
that we called
Es decir, hablamos de estructuras
cis-patriarchal
binarias compuestas por
binary
una mayoría de
structures made
hombres
up
cisgénero en posiciones de
by
poder,
mostly cisgender
hombres
men
blancos,
in positions of
heterosexuales,
powers, white
etcétera,
men,
frente a una
heterosexual men,
mayoría de mujeres cisgénero
before
en posiciones de
a
subordinación.
minority
Solo
of
las
cisgender
figuras
women
sombreadas
in
en
coordination
lila
roles. The
serían
women
las que
in
tenían algún
purple
conocimiento
were
sobre
those who
perspectiva de
had
género
some
interseccional. Y claro,
knowledge of
este tipo
intersectional
de
gender
estructuras no son
orientation.
neutras, sino
These
que
structures are not
impactan
neutral.
directamente
They have
en
a
el modelo
direct
de intervención
impact
y en la
on the
intervención
intervention
en
model
general.
and the intervention in itself.
La segunda investigación
The second research project
fue impulsada por la Federación
was
Catalana de
promoted by
Drogodependencias
the
en
Catalan
España.
Drug Dependency Center here in
Se
Spain,
desarrolló en
and
Cataluña
it was carried
y
out in Catalonia,
contó con el apoyo del
and it was
gobierno local.
supported
Tenía como
by the
objetivo
local
visibilizar
government.
las
The
barreras
goal was
en la
to
red de atención de
visualize
drogodependencias hacia el
obstacles
colectivo
in the
LGBTQI.
drug dependency service network
Y aquí veis
as
las
regards
barreras que describe muy bien el
LGBTQIU
estudio.
users. Here you
Vemos
see
el estigma
the
y
obstacles
autoestigma
that
que
we
se
found,
amplifican
stigma,
cuando
self-stigma that are
intervienen otros ejes de
identified
opresión, es decir, no es lo mismo ser un
with
hombre gay
oppression
blanco en una
structures. It's
comunidad
not the same thing
terapéutica que
to
ser una
be
mujer
a
trans
white gay man
racializada en una
in a
comunidad
therapeutic
terapéutica,
community
por
as it is to
ejemplo.
be a
La
transgender
falta
woman
de
in the same
normativas o
scenario.
protocolos
A lack of
inclusivos, como
regulations
por
or
ejemplo la
inclusive
falta de mecanismos
protocols,
estandarizados
a
de
lack of
denuncia de
standardized
violencias
mechanisms to
LGTBI-fóbicas
report
en los servicios
instances
de
of abuse
drogas.
in drug services and drug centers.
La falta
Also,
de
a
modelos de
lack
intervención muy
or
centrados en la idea de dejar
intervention
de
models that were
consumir y no
very
en los motivos
focused on the
para
idea
hacerlo,
of
que en el caso de las personas
cessation
LGTBI
of drug
pueden
use,
estar vinculados
and
a la
this
necesidad de fluir y de performar el género, pero también al estigma y
needs
discriminación
can include
asociados a la experiencia LGTBI.
a gender perspective
Las
and
actitudes de
stigma,
profesionales que
also
miran hacia otro
professional
lado ante las
attitudes
violencias
who look the other
LGTBI-fóbicas en
way
los servicios,
in the
la
cases
falta
of
de información
violence
y formación
that
de
occur in the centers,
profesionales, por
a lack of
ejemplo,
information and
circulan
training.
muchos mitos alrededor
Therefore, this
del
perpetuates a
chemsex
lot
o
of
hay un gran
legends
desconocimiento
or
sobre
urban
las
legends such as
interacciones entre drogas y
sex.
hormonas entre
There's
la
little
población
knowledge about
trans.
the interaction between
La falta de
hormones and drugs
investigación,
for the transgender
ya que la
population,
mayoría
a
de
lack of
investigación en el
research.
ámbito de
Most
las
of the
drogas
research done
aún
in
se basa en
the
muestras muy
drug
cis heterocentristas
subject matter are
y
still
excluyen
very
algunos
cis
colectivos, como sería el
heterocentric
caso de las
and
mujeres
exclude
lesbianas o de las
some
personas
orientations such as
intersexuales.
lesbian women or
Y
intersexual women
finalmente la
or
falta de
persons, and
programas
a
especializados
lack
para el
of specialized
colectivo
programs
LGTBIQ, aunque
for the
existe este debate sobre si
LGBTQ
es mejor
group. There's still a
incorporar la
debate
perspectiva
around whether it's
LGTBI en
better
los
to
servicios de drogas
include
ya
the
existentes o
LGBTI
crear
perspective in existing
servicios
services or
nuevos,
create
específicos.
new services specifically for this community.
En cualquier caso,
In
esto
any
se me ha
event,
colado antes, todas estas
I forgot to mention
barreras
this
no
earlier,
dejan de
all of these
constituir
obstacles
violencias
are forms
institucionales
of
que al final
institutional
limitan el
violence
acceso y
that
permanencia de las
limit the
personas
access and
LGTBI en los
permanence of
servicios de
LGBTI
drogas.
persons in drug
Aquí os
centers
he puesto algunos
and drug
ejemplos de lo
services.
anterior
Here
y sí
are
que me
some
quería
examples of what I've been
detener
talking
en
about,
el
and I wanted to
ejemplo en
focus
rosa
on
fucsia,
this
que es un
this pink
ejemplo de
bubble that is an
patologización y
example of
psiquiatrización de
pathologization
las
and
personas, en
psychiatrization
este
of
caso de una persona LGTBI,
this case an LGBTI person
en los servicios de
in
salud mental.
a
Y
mental
cómo
health care
esta
service, and how
hipermedicación
this
supone
hypermedication
o
approach
induce a un uso
leads
abusivo
to
de
or
sustancias.
induces an
Esta persona
abuse
dice, yo
of
empecé a ser psiquiatrizado a
substances.
los
The person said,
17
I
años porque
began
mi
to be
familia se enteró que
psychiatrized
yo
when I
era
was 17
maricón.
because my
Y
family
tuvieron
realized that I
9
was a
meses como puto
faggot,
vegetal.
quote unquote
Es
faggot,
además una
and I
dinámica que vemos mucho en
spent 9
supervivientes de
months
violencia
like a fucking
machista en
vegetable.
general,
And this is
precisamente porque no
something
se implementa
that
la
is probably not the first time
perspectiva
it's happened with this male sexist
orientada al trauma
orientation in these
y que
centers
sin
and a
duda
trauma
constituye una forma
orientation,
flagrante muy
and
grave
it
de
is a
violencia
flagrant
institucional.
violation of this person's rights
Finalmente,
and an
ambos
example of institutional
estudios
violence.
señalan
The
algunas
research
recomendaciones,
studies came up with some
como por ejemplo la
recommendations, as I'm
transversalización de la
indicating here, such
perspectiva
as the
LGTBI en los servicios de
transsexualization
drogas o la creación
in
de
drug
servicios
centers
específicos
and the provision of specific services
adaptados
that are adapted to this
para
community
generar entornos
to
seguros con
generate
equipos
safe
sensibilizados y
environments
formados que
with
incluyan
sensitized,
personas con
well-trained
experiencia vivida, etcétera.
teams, people who
Sin
have
embargo,
experience,
tal y como apuntan ambos
actual
estudios,
experience
no dejaremos de
in
insistir
these
en la
centers,
necesidad de
but
implementar cambios estructurales
there
que
will always be a
permitan
need
cuestionar y
for more
repensar
structural
el modelo de
changes that
intervención, la
question and
cultura de la
rethink the
organización,
intervention model,
los
the
valores de misión de la
organizational
organización
structure,
y
the
también de
values and
hacer
mission of these centers,
alianzas
and to
estratégicas
form strategic
a nivel
alliances
comunitario,
at the
local,
community,
internacional,
local, and
que
international
permitan
levels
superar los
that will allow us
límites
to
de las
overcome
políticas y
the limits
legislaciones
of policies and
locales,
legislations
nacionales,
at the
que en algunos
local and
casos
national
vemos
level
muy
that
marcadamente
we often
anti-LGBTI,
see that are very
anti-derechos humanos, de
anti-LGBTI,
extrema derecha,
anti-human
como
rights,
estamos
very
viendo en
much
algunos
from the
países de
far
Europa,
right
incluida
end
la
of the
Unión
spectrum.
Europea
This
y en
is
el
happening
mundo en
in Europe,
general.
even in the
La idea
EU
general
and the
es
world
que
in general. The overall
estos
idea
cambios
is that
estructurales son
these
la base
structural
para poder
changes
implementar de
are
forma
the
más sostenible y
foundation
duradera
to
los
implement
cambios
in
que
a
veis
more
arriba
sustainable,
en verde
long-lasting
y
way
así
all of these
poder
recommendations that
contribuir
you see in the green
efectivamente
box,
a
and
desmantelar
to
las barreras de
contribute
acceso y permanencia de las
to
personas
doing away with
LGBTI
these
en toda su
limitations of
diversidad y
access
de
of
las
the
personas en toda
LGBTI
su
individuals
diversidad
and all their
en los
diversity
servicios de
to
drogas.
the
Muchas
proper
gracias y
drug
seguimos
services that they need.
conversando.
Thank you very much, and we hope to continue this conversation with
Muchísimas
you.
gracias, Laia. Siempre es
Thank
un
you,
placer
Laia. It's always
escucharte
a pleasure to listen
y
to
sobre
you,
todo por
and
poner sobre
especially
la mesa las
for
violencias
showing so
institucionales que se
clearly these
siguen
examples of
reproduciendo desde las
institutional violence that
instituciones,
are occurring
la traducción
at
a
the
la
institutional
investigación
level, and
y
how
las
this comes
implicaciones que
through in
todo
the
esto tiene. Así
research
que
and
seguro
all of
que
the
seguiremos conversando
implications
después
that this
en
has, and I'm
la
sure we
parte
will
de preguntas
continue
y respuestas.
to discuss
Muchas
this during
gracias de
the
nuevo.
Q&A period. Thank you once again.
Now,
And
our next speaker, we are pleased to welcome Ed Carlson, the Chief Executive Officer of Odyssey House Louisiana, a position he has held since January 2005, with over 35 years of experience in the human services and addiction fields. Ed has dedicated his career to expanding outreach and services for those affected by addiction. As CEO, he oversees programs, design, and implementation, while managing staff as well, resources, and fiscal health. Ed has served on numerous advisory panels, focusing on policy recommendations that establish responsive systems and best practices to reduce the cost and suffering associated with substance use challenges. Thank you very much for being with us, and the floor is yours.
Giselle, hi everybody. Giselle, I want to thank you for putting this on and for all your hard work in relation to this. And of course, Dianova's continuing advocacy, national and international work that you do. So very honored to be here and be part of all these great panelists and with some amazing information. So as Giselle said, I'm Ed Carlson. I'm the CEO of Odyssey House based in New Orleans, Louisiana in the United States. And I want to talk about how inclusion matters and the importance of inclusionness for people, especially in the LGBTQI plus community. Okay, why doesn't all of a sudden this isn't working? So Odyssey House in Louisiana, we were established in 1973. The mission of Odyssey House is to provide holistic and client-centered services in a safe environment that addresses the full continuum of special care needs for the state of Louisiana. OHL's encompassing system of care includes medically supported detox, residential inpatient treatment, behavioral and medical health care, life skills counseling, case management services, and housing. Through our services, OHL empowers individuals to become active participants in their treatment and recovery to reclaim functional, productive lives. We like to say we empower people to conquer addiction. So the challenges. So the LGBTQIA plus population experiences statistically higher rates of substance use disorder compared to their heterosexual counterparts. Elevated use of substance use is linked to increased risk of HIV transmission, especially among gay and bisexual men. Transgender individuals have been identified as displaying higher risk of substance use behaviors compared to cisgender individuals. The LGBTQI community faces significantly increased trauma as a result of various factors. Underrepresented, understudied, stigma and discrimination, multiple subgroups with individual sensitivities and considerations. So starting with the obvious, inclusion matters. It sounds simple, but it comes with a host of considerations and challenges. OHL is a service provider of last resort. A lot of times people come into our program with just the shirt on their back. And and usually we'll take the people that no one else will take in our state. We have a whole person's care is a core approach to how we provide services. We have a modified therapeutic community concept of community as a method, and we use this concept specifically in our longer term program. Treatment and recovery is the main focus for our community. So we figured out that, and you don't have to be a rocket scientist to figure this out, but most of the studies around addiction show that there's two primary things that have the most important aspect to people being successful. The first one is access. We know that if somebody has that break in their wall of denial and they reach out for treatment and treatment is there and accepting and available to them, they're more likely to engage in the treatment process. The next one is retention. The longer you keep somebody involved in the treatment process, the better the outcome for them on the other end to stay clean and sober. So combining all of our things together, everything from prevention, outreach, community health center, SUD treatment, medically supported detox, and also we do homeless services where we operate a low barrier shelter. And we organize all of the work and services that we do around these two primary principles, access and retention. So let's start from access, specifically with various populations. Culturally competent services, and this is super important to us. We have to set expectations from the start. All OHL staff complete a diversity inclusion training. The training is comprised of ground rules, OHL's diversity and inclusion statement, language, pronouns. When you miss the mark, how do you deal with that when you miss the mark on the problems when you're trying to work with special populations and getting people to feel inclusive? Understanding the experience of the trans individual, and also reflection so that people can talk about how they feel about the things that they're dealing with. Names and pronouns have processes in place regarding respecting names, pronouns that may be different than the ones assigned at birth. In our EHR and electronic health records, and also placement in our treatment programs. So inclusion in residential treatment. So we have co-ed treatment spaces. So people get to self-identify for what dormitories and areas that they want to go into. How they identify themselves is how we treat them. Gender-specific groups. So we have groups specifically designed for gender-related, for people's gender and gender issues. Specialized groups with curriculum, individuals living with or at high risk for HIV. We do a lot of motivational interviewing, cognitive behavioral therapy, incorporation of self-empowerment. So inclusion is in primary care. So also we think it's important from a healthcare perspective, not only are we dealing with their substance abuse issues, but we're also helping with their primary care issues. Connection between treatment and primary care, HIV and Hep C testing and education, PrEP treatment and education, and transgender healthcare services. So inclusion and prevention outreach. We do this also in on-site HIV testing, and we're at a lot of community events, destigmatizing issues related to this, being present, visible in the community, and in our social media. Inclusion and housing. So as I mentioned, we have a low barrier shelter. We have an area specifically for people who are transgender and who don't feel comfortable being in the main population when they're in a dormitory setting. And we also, in many shelters that we have found throughout, not only in Louisiana, but throughout the United States, are gender specific. And if you don't, if they're not open to your gender of choice, you can be denied if you're homeless. So we do a lot of continued education and training for staff, specifically the LGBTQ essential foundations of care, covering foundational LGBTQ terminology, health disparities, and care framework while exploring strategies to implement best practices, hearing and using LGBT affirming language, introducing terms related to the LGBT community, and how to reflect back and the language a patient uses describing their identity. Working with patients who are transgender, guidance on working with transgender patients, including respectful terminology, aspects of transition, and resources of best practice in gender care. Evolution and learning. We're open to change, focusing on non-judgmental care, listening and accepting, and being visible ally. Thank you. I really appreciate this opportunity. I hope this was very helpful. And also, I'm always available. My email is here. If you have any questions or you want additional information or a lot of the materials that we've developed at Odyssey House, we're always happy to share. Thank you very much.
Thank you very much, Ed. Thank you very much for this inspiring presentation. So we are moving on with our next speaker, Cristiana Vale Pires. We are excited to welcome Cristiana. She's a dedicated advocate for the rights and health for LGBTQIA+ individuals. Cristiana focuses on the invisibility of LGBT community drug use patterns and trends in monitoring. Her work emphasized culturally responsive approaches and models of care tailored for LGBTQIA+ people who use drugs. With extensive experience in community intervention, Cristiana aims to shed light on the unique challenge faced by this community and propose actionable strategies for improving care and support. So thank you very much, Cristiana, for being with us today, and the floor is yours.
So hello, everyone. Thank you, Gisela, for this lovely introduction and also for the invitation. It's my pleasure to be here together with other colleagues and folks doing interesting work, and also seeing old colleagues. For example, I had the great pleasure to co-create also knowledge on these topics in the past. And well, now I will share my presentation. Are you already seeing it, right?
We can see it. Yeah.
Okay. So yeah, the topic I brought today, I could talk about several things related with queer drug subcultures and also the experiences of LGBTQ people from different groups of the LGBTQ communities regarding their access to services and drug use patterns and other topics. But I brought today I decided to bring a more wide kind of reflection to think what can we do to make it more visible, the priorities and specificities of LGBTQ people who use drugs, and also to promote some transformation and transition in our services and models of care to embrace and take care of the specific needs and experiences of these people. So I begin with my place of saying what is my place of speech. This is important for me because I'm here not as a person with lived experience, even if I have my questions regarding my gender identity and sexuality, of course, as all of us have. But I'm here as a professional that are coming from harm reduction. Mainly my focus is on harm reduction and also psychological counseling, and as a researcher that had been involved in several projects and designing specific studies to increase the knowledge we have regarding the specificities and priorities and experiences of LGBTQ people who use drugs. So, and for this for this presentation, I had these I bring these two big questions. The first one is the question to think if drug monitoring and research is LGBTQI inclusive, mainly because we work with several data, and as we know, it is the data regarding drug use patterns, drug use profiles, risks and negative consequences related with the use of specific drugs that inform the design of services, of drug services in all the spectrum from prevention to treatment. And for this reason, it is important to think what are the groups that are hidden and completely forgotten in our mainstream drug monitoring sources. And the truth is that we continue to have gender data, or let's say information regarding drugs, segregated uniquely by the biological sex, and usually in the binary female and male. And for this reason, all the other people that probably were assigned as woman or man when they were born, but they identify as a trans person, a non-binary person, or have another kind of experiences that are super relevant for their living experiences, and also the way that will be introduced to drugs and probably create a relationship with specific drugs is completely making visible when you use sex as our unique dimension, as well as the sexuality and sexual orientation dimensions. So recent recommendations from the European Agency for Gender Equality and also from European Commission, they suggest that we begin using a two-step approach or even a three-step approach when collecting like social demographic data related regarding the gender and identity. And this two-step is like to collect information regarding the biological sex as male, female, and intersex, and then gender identity in terms of the experience, also feeling living as a woman, a man, trans woman, like a cisgen, the experience of being cis or trans and non or navigating in a non-binary spectrum. And there are some studies that are already implementing this two-step approach. For example, the European Web Survey on Drugs promoted by the European Agency, European Drug Agency, previously MCDDA, it's now including, this two-step approach to identify the specific drug use patterns and experiences of trans and non-binary people. And considering also our experience at Cosmic Air, because we had in 2023 a specific web survey to identify the specific needs of LGBTQ people who use drugs and experiences, drug use patterns, and so on. It's also relevant to not only use quantitative studies, web-based studies, but also qualitative ones, because there are, in terms of intersectional inequalities, that are specific groups of the LGBTQ community that tend to be systematically excluded from, this kind of studies, because you need time, you need to get access to, like a computer or something. You need to have a specific literacy to understand the topic of the questions and availability to participate in the study, particularly when you don't have, a donation or a compensation to give for the time the people uses to give you their expertise. So it is also important to consider other, in one hand, gender indicators in drug research, but also to consider participatory approaches to make it sustainable and possible to represent the historically oppressed groups of the LGBTQ community. And here I'm referring specifically to trans women that are one of the groups that have more oppression or that experience more oppression, particularly women, trans women who use drugs, who are engaged in sex work and all these dynamics that are particularly excluded sometimes from the the research, drug research studies. And in our research, this is very brief, just to bring another discussion, because sometimes when we talk about drugs and LGBTQ community, There are several people that think that the drug use pattern is chemsex, but it is not. You know, chemsex is a specific sexualized drug use pattern that emerges particularly among men who have sex with men, gay people, and some trans and non-binary people, but doesn't represent the full experience of LGBTQ people who use drugs. And here is the first complexity, or the first thing to consider, is the heterogeneity of experiences and heterogeneity of socialization processes and relationship with drugs, drug use patterns, profiles of life trajectories, and so on. And again, here it's important to refer that we need to think in drug monitoring and research tools to guarantee that we represent, the traditionally and systematically underrepresented groups in drug monitoring and research. And here I bring another data from our study. And in this particular study, this research we implemented in Portugal from the Queer Care Project, we had, data similar data to the one Laia just shared. That is, in one hand, we noticed that LGBTQ community usually have a very good literacy regarding their knowledge of the, community services, doing HIV and STI screening tests, or sexual health services in the community, or LGBTQ health. So they really have a very good literacy in terms of this kind of responses. But as you see here, 90% of our sample set, they didn't have access. And even they don't know, services working in the drug field. On the other hand, those who refer having, access, or they contacted with services in the drug field, they reveal, that they had the language and the overall service was not adequate, and also the information regarding the specific drugs they use, because the LGBTQ people don't use the same drugs, or exactly the same drugs, or exactly the same drug use patterns we find in the mainstream or heterosexual groups. They tend to be trendsetters in terms of experimentation with new drugs and so on. And for this reason, they also found, lack of literacy regarding specific information related with the drugs they usually use. And this, of course, makes some distance, or makes them unavailable and resistance to access to drug services. And then, considering this, and considering, our experiences as people implementing or creating models of care for, people who use drugs in the community, it is important to consider several things. In one hand, of course, we are always discussing this at Cosmic Care. So our time is very limited. We have very, we have lack of funding, and it's impossible to create specific services. And it's also impossible and very difficult to have budget or to have funding for people who use drugs with who experience, who are impacted by intersectional inequalities. For example, people engaged in chemsex, or sex workers who use drugs. It's too specific for drug funding. It's too specific for gender funding. It's too specific for sexual health funding. So it's too specific for everything, because their experiences are intersectional, and the services are, and the public policies and the services are segregated. You have the drug policies, you have the sexual health policies, and then you have the gender policies, and it's very difficult to really move from the universality of the interventions we have to apply to get the fund, the competitive funding. And then we have also opportunities. Laia talked about some of them. In one hand, and also the other colleague, Ed, of course, cultural competence is something that is related with the possibility of increasing our awareness, also to bring to us the resources from the queer theory or the safer space policies and another kind of discussions that are more around other scholarships. And also to think collectively in gender responsive approaches and how we organize our services, but also these allyship and these alliances that we can build collectively in the community, as Elia said before. And here I have a toolkit we developed. It is in Portuguese. I can share in the chat if you want. That is, something we created with a very small funding we had, and we put our effort in creating some reference for those working in the drug field. And finally, I think to begin thinking or designing, responsive models of care that are able to make visible, represent, and respect the priorities and specificities of LGBTQ people who use drugs, I think we need to begin reading and learning about the feminist and queer contributions from feminist and queer theory. They are great, amazing. It's also an opportunity to increase and to make questions about the way we do things, and be more critical in the way we deliver services, because everyone is socialized in this deeply gendered society. And so I think this is relevant for everything we do and all the fields of intervention. Also, we need to consider the specific risks, but also the wishes, the priorities, the role that drugs can have as solutions to deal with, systematic oppression and with pain, and also to contact with pleasure, to deal with internalized gender oppression and so on. So I think it's very relevant that we question also the way and to re-signify, the role of drugs, for these people and all the people in general. And of course, to increase our capacity building and increase the representativeness in our teams, we need more trans, non-binary people working in our teams, For example, we have this example in Cosmic Care. We have, a growing number of non-cisgender people working in our team, and this really increases our cultural competence, makes the community trust in us, and this is also very relevant. We need to talk about the services and how we deliver it, but also how we organize our interventions and who we as practitioners represent. And yeah, we need to move beyond the hyper-focus on individual and public health indicators. Okay, are important, but we need to talk also about other kind of indicators, more social, more related with agency, more related with structural inequality and so on, because these explain why some people engage in problematic drug use patterns. And finally, of course, to increase safety is important. But what I learned from LGBTQ people who use drugs is that it's not enough to make them feel safe. They want to participate, they want to be respected, heard, and considered, let's say, holistically. So I think I finished my presentation here. Thank you very much.
Thank you. Thank you very much, Christiana. I'm pretty sure that a lot of questions may arise from your presentation. So I encourage all the audience to put your questions on the Q&A chat box, and we will collect them afterward. We have enough time. Y vamos a pasar a nuestra próxima panelista. Nos sentimos honradas de presentar a Xochitl Mejía Mencía, quien se enfocará en los desafíos que enfrentan las comunidades LGBTQI+,
who will focus on the challenges faced by the LGBTIQ+ communities in Latin America. With 15 years of experience in addiction prevention and treatment,
Y es actualmente la
Chotiel
directora
Mejia is
terapéutica del
currently the
Centro de
therapeutic
Desarrollo Humano
director of the
Tonali y miembro
Centro
de
de
la Red
Desarrollo Humano
Iberoamericana de
Tonali
Organizaciones No
and a member of the
Gubernamentales que trabajan en
Ibero-American Network of
drogas y adicciones,
non-governmental
que es
organizations
RIOT.
working
En
on drugs
2014
and
participó en el
addictions,
diseño de
RIAD.
instrumentos para
In
capacitar y certificar
2014,
a
she
consejeros de
participated in the
adicciones
design
del
of instruments for
programa
the training and
PROCER
certification of addiction
y ha sido
counselors
galardonada
of the
con el premio
PROCER
Reina Sofía
program.
contra las drogas en
She's been
2010 en la
awarded the
categoría
Queen
de
Sophia
prevención.
Award against drugs in
Además, asesora
2010 in the
equipos
category of
terapéuticos y
prevention.
es docente en diplomados
She also
y
advises
cursos
therapeutic teams
especializados
and
en
teaches diploma
adicciones.
courses
Chotiel
and specialized
examinará la
courses on
intersección entre
addictions.
políticas de drogas,
Chotiel
los
will examine
esfuerzos
the
de la sociedad
intersection between
civil
drug
y
policies,
los
civil
problemas
society efforts, and the
persistentes que
persistent
afectan a
problems
las comunidades
affecting
vulnerables
vulnerable
en
communities
América Latina.
in the Latin American
Maravillosa
region.
intersección y
It's a
muchas
wonderful
gracias, Chotiel.
intersection
La
to
palabra es
discuss.
tuya.
Thank you,
Gracias.
Chotiel, and you now have the floor.
Muchísimas gracias a
Thank you
ti,
very
sí,
much,
por la invitación y
Gisela,
a
for your
Dianova
invitation,
Internacional en
and Dianova
específico por
International
darnos este
for giving us
espacio y
this
voz, que
space
siempre
and
estamos muy
opportunity to express
agradecidos
ourselves.
de
We're always
formar
very
parte
grateful
de estos espacios de
to
aprendizaje
form part of
y de
these learning
comunicación.
spaces
Pues voy
and communication. Now,
a compartir mi
let
pantalla.
me share my screen with you.
Genial, pues efectivamente la idea es darles,
Great. Yes, in
compartir este
fact,
panorama
the
desde América
idea is
Latina,
to
de
share
cómo
our
vivimos las
outlook from Latin
organizaciones
America and how we
desde
organizations are
nuestro trabajo
experiencing
del día a día.
our day-to-day work.
Quisiera hacer una mención que,
I
como
would
bien
like to
decía
mention,
Gisela,
as Gisela
formo parte de, o
correctly said,
represento el día de hoy
I
a esta
represent
red maravillosa que
this
es la
wonderful
RIOT,
network,
en donde no
RIAD,
solamente voy a hablar del
where
contexto
I
que
can
pasa en
speak
México,
not only about what is
sino
happening in
intentaré
Mexico,
dar voz a lo
but
que
I can
hacemos en la
also
Comisión de
mention
Género
what we
de la
do in the
Red Iberoamericana,
Ibero-American
desde las
Network
organizaciones que
Gender
trabajamos
Committee, the
en
different
tratamiento y
organizations
prevención
working in treatment and
con
prevention
perspectiva de género.
from a
Entonces,
gender
bueno,
perspective.
definitivamente yo escuchaba a los anteriores
I was
panelistas
listening to the
y me
previous
parece que hay muchas
speakers, and
coincidencias,
I think
¿no? En
we have
cuanto a
many things in
estos
common
retos, barreras
in terms
con
of
los que
these
nos encontramos las
challenges and
organizaciones
barriers
a la
that
hora de trabajar
we encounter as
con
organizations when it comes
comunidades
to working with
específicamente
LGBTIQ
nosotros trabajamos
plus
con
groups.
mujeres lesbianas,
We
bisexuales
work
y
specifically
transgénero
with lesbian, bisexual, and
en
transgender women,
varias ocasiones y nos
and
encontramos,
we've done so on
coincidimos
several
en muchas de
occasions,
estas
and
barreras, pero
we
creo que es
coincide
importante hablar
in many of the
también de las
barriers, but
diferencias,
it's
¿no?
also important to
De lo que
speak of
pasa
the
en América
differences
Latina.
as to what is
En
happening in Latin
general,
America
la
in
mayoría de
general,
nuestros países
and in most of our
tienen
countries.
dos
We
factores
could
que son
say there are
sumamente
two
importantes a la
very
hora de llevar a
important
cabo
factors when it comes
programas
to
y
carrying out
acciones con perspectiva de género,
programs
que es
and
el
activities with a
que
gender
la
perspective.
mayoría de nuestros países no
And that is that
cuenta hoy
most
por
of
hoy
our
todavía con
countries
cifras
still don't
contundentes,
have
con
clear
estudios, con
figures,
investigación suficiente
studies, or
para que
research
nosotros
on
veamos o sepamos
this
cuál es
field in order
la
for us to
realidad
really know
exacta
the
en nuestros países.
reality
Entonces creo que
in our
es como una
countries.
laguna muy
So
importante.
this is
Trabajamos
a
mucho
huge
desde
shortcoming.
lo que vemos,
We
desde lo
speak
que cada vez más
oftentimes
en
and work
algunos países,
oftentimes based
Argentina,
on
México,
what we
Colombia,
see firsthand,
se
Argentina,
van
Mexico, Colombia.
poniendo como
We
estos lentes, ¿no? Para
are wearing
analizar la situación desde esta
certain
perspectiva
sorts of
y para estas
glasses, so to speak,
comunidades, pero es
to
cierto
analyze
que
these
hay mucho
communities,
todavía
but
por hacer
there's
en
much left to
estas
do
regiones. Y
in
la
these
otra
regions.
es la
And number
histórica
two,
falta de recursos que
the
tenemos en América Latina. Hay
now
muy buenas
historic
intenciones, muchas
lack
veces, sobre
of
todo desde la
resources
sociedad
that we
civil,
find in
de
Latin America.
atender, de
The
hacer,
civil
de
society
generar,
has the
pero
best
muchas veces nos
intentions to
convertimos en
do things,
estos
to generate things,
MacGyvers, ¿no? Que con
but
muy
you have to
poco
be like
tratamos de
MacGyver,
generar
who
mucho
can
para poder llegar. Entonces,
invent a
con
device out
esto
of
creo que hay, antes de hablar de
unlikely
estas barreras de
components
acceso que
and very little
coincido
resources.
con mis
So
compañeros
I do
panelistas, también
coincide with the other
entender que en
panelists,
América Latina
but you
tenemos
should also
estos
understand
dos
that in
grandes
Latin America
factores
we
que
have these two
siempre
big
están ahí
factors that are always present
formando un papel importante,
and
¿no?
playing a very
Estos
significant
factores
role.
sociales, legales y estructurales que pues,
Also,
van
other social,
perpetuando la
legal, and structural
discriminación
factors
y
that
la
perpetuate
exclusión
discrimination
en
and
el
exclusion
tratamiento de
when it comes to
adicciones.
addiction treatment.
Coincidimos
What we do have in common
las estadísticas, ¿no? Generales que
is
tenemos en la
that
región
in the
es que
general
el acceso a
statistics
servicios de salud para la comunidad
is
LGBTIQ+,
that
es
the
limitado en
access
gran
to
parte de América
healthcare services
Latina
for the
y específicamente las
LGBTQI plus
mujeres
community is
de
very
esta
limited,
comunidad enfrentan aún más
especially
barreras.
women
¿Por
from this
qué? Porque
community
hay
who face even more
esta
barriers,
doble
because there is something of a
barrera
double
para estas
barrier
comunidades.
for
Por un lado es
these
la
communities. On one hand,
discriminación por el género y la
discrimination
orientación
due to gender
sexual.
and sexual
Por lo
orientation,
tanto, es una comunidad
and therefore
que se
it's
enfrenta a
a
la homofobia, la
community that
transfobia y a
faces
la
homophobia,
misoginia.
transphobia,
Los principales
etc.
barreras en el tratamiento
The
para
main
esta comunidad,
barriers
como
to
han comentado
treatment for this
también
community,
mis compañeros, pues es
as
la
my colleagues have
discriminación
also
en los
said,
sistemas de salud.
are first
Muchas
of all
veces hay este
discrimination in
estigma
healthcare
ya desde el
systems.
primer
There's
momento, ¿no?
often
En el
stigma
diagnóstico
from the get-go
y por
in
supuesto en el
diagnosis,
tratamiento.
and of
Hay
course
una
also
gran
in
carencia en la
treatment.
capacitación
Number
del
two, there
personal
is
que
a great
atiende los
shortcoming
programas
in the training
de
of
adicciones y salud
personnel
mental
in
respecto a
addiction
diversidad
and
sexual. Y
sexual
yo
diversity,
diría que no solamente de
and
capacitación, sino
not just
también de
training, but
sensibilización
also
para entender
sensitivity,
cuál es el
the sensitivity necessary
fenómeno que se
to
trabaja.
truly understand this
Por lo tanto,
phenomenon
esto
that they are
genera pues
working with.
ambientes
This generates
hostiles, poco
hostile and
receptivos y muchas veces
unreceptive environments
retraumatizantes,
that
¿no?
are often
Muchas
forms
de
of
las barreras de
re-traumatizing the
acceso a
individual.
tratamiento es
Many of the
porque
barriers to
en países de
treatment
Latinoamérica, por ejemplo en
access are
México, se
because
siguen
Latin
teniendo
American countries such as Mexico,
desgraciadamente muchos
unfortunately, still
clínicas o
has
comunidades,
many
y le hago
clinics
entrecomillado
or
porque
communities. I'm
terminan siendo
putting
espacios
quotes
de
around this
maltrato y de violencia
because they are
y
often
de
actual
retraumatización.
centers of abuse and mistreatment
Es
and
importante
re-traumatization.
también hablar de
It's also
que
important to
de
talk
la
about
desigualdad geográfica y socioeconómica
the
que existe, es
inequality,
decir, aquí en
geographic
América Latina se siguen
inequality,
centrando
socioeconomic
los
inequality.
pocos
In
programas
Latin
que hay con
America,
perspectiva
the
de
few
género y
programs
que
that
atienden las
exist
verdaderas
with a gender
necesidades se siguen
perspective and that
centrando en las
understand
grandes
sexual
ciudades.
diversity, they're
Pero
still
hay
only
todo
in the
este
big cities.
sector
But there's an
rural
entire
que es
rural
muy
world,
grande en nuestros
a very
países que
large
no es
rural world in our
atendido
countries that is not
ni
having
mucho
their
menos
needs met,
visto. Por
not
lo tanto, pues
even being seen,
evidentemente
in
hay falta de
fact.
recursos específicos
And so there is a
y las
lack of specific
clínicas o
resources,
los centros de
and
tratamiento no
the
están
clinics
preparados para
or treatment centers are
abordar
not ready
estos factores de riesgo que
to
son
work with these
únicos.
risk factors, which are unique to this group.
Específicamente,
Specifically,
como decía, me gustaría
as I was
compartir como
saying, I would like to
esta
share
experiencia que tenemos de
this
trabajar
experience that we have
con
of
mujeres de la comunidad
working with women from the
LGBTQI+ en América
LGBTQI
Latina.
plus group
Y
in
bueno, como ya
America,
decía, hay
Latin
esta
America. As
doble
I said, there
discriminación,
is a double
¿no? Por
discrimination
la
in place
violencia de
due
género
to
y la
the
orientación o
gender
identidad
violence
de género
and
que esta comunidad representa
the identity
desgraciadamente para
of
muchos.
gender that is represented
Y
in
esto
this
impacta,
community.
evidentemente impacta
And
en
this
el
has
acceso
an
a
impact. It
los
has an impact on
tratamientos.
access
Como
to
yo
treatment,
decía,
which, as I
además de que el
said,
personal no está
not only
sensibilizado,
is the
aquí
person
mucho de lo que nos
sensitized,
encontramos es que
oftentimes
se
we find
trabaja como con
that
lo básico.
work
Sabemos que esta población
is done
está
in such a way that
en su mayoría ha vivido y ha tenido
this population
situaciones de abusos, de
has
trauma y de violencia.
experienced
Entonces
situations
es
of abuse,
muy
trauma, and
importante
violence.
que
So it's
los
very,
centros de
very
tratamiento
important
en América Latina ya no se centren exclusivamente en la
that treatment
atención
centers in Latin
a
America
la
not just
adicción,
focus
sino que también
on
empiecen a
treating the addiction,
capacitarse y a trabajar de manera
but they
específica
train
en el
themselves to work
trauma,
specifically
violencia y estrés
in
postraumático
trauma,
para poder dar
violence, and
una atención
post
mucho más integral. De
trauma
hecho,
stress
en este
to
punto me
much more
gustaría
comprehensive
detenerme
care.
para
And I'd like to
comentar que
stop for
desde
a
la
moment
Comisión de
here and
Género en
say
la
that from
RIOD
the Gender
hemos hecho
Commission
un trabajo
in
desde el
the
año
RIOD
pasado muy
group,
interesante, que
we
es
did an
que
interesting study
generamos una
last year.
matriz de indicadores, es
We
decir,
generated an
es
indicator
un
matrix.
checklist
That
básicamente
means
para
that
los equipos
something
de
like a
trabajo de
checklist,
comunidades
basically for
tratamiento
the
en
community
adicciones,
work
que nos
teams
ayuda a
for
autoaplicárnoslos en
addiction
nuestras
work,
propias organizaciones para
treatment,
saber si
that
realmente
allow us
estamos
to adapt
cumpliendo
in
con
our
los
organizations
básicos
and
de
know
tener un tratamiento
whether
de
we
perspectiva de
are meeting the
género
basic
y que
needs
garantice
for
los
a treatment for
derechos
this group.
humanos de las personas. Entonces, bueno, les invito, hago el comercial a
So
este
I
documento y
invite you
este
to
instrumento está
check that,
de manera gratuita
and
colgado en la
you have
página
free
de la RIOD para quien quiera
access to
acceder
it.
a él. y que de verdad ayuda
for
mucho a nosotros
people who are
como
interested.
organizaciones
And it
para hacer
helps
como
people like
esta
us in
revisión
organizations
de si estamos aplicando estos
to
indicadores que son
apply
necesarios
these
para hacer un buen
necessary
trabajo
indicators that are
con estas
indicators that we
poblaciones.
need to do a
La
good job
falta de
with these
programas
population
de
groups.
tratamientos sensibles al género
Also,
y la
the lack of
diversidad, evidentemente, como ya se decía,
programs,
aquí en
treatment
América
programs that
Latina
are sensitive
también hay
to
una
gender and
falta
diversity.
tremenda de
As I've said,
espacios seguros.
there's a significant
Las
lack
normas en
of
las
safe
comunidades y en las
spaces.
clínicas siguen
The
siendo
rules in communities and
heteronormativas y
clinics are still
patriarcales, por lo tanto, es
heteronormative and
importante empezar
patriarchal.
a generar
Therefore, it is very
este cambio de
important that
paradigmas.
we shift the
Y
paradigm
obviamente la
in
ausencia de
that
espacios que
regard,
cubren
and
las necesidades
also the lack of
específicas de esta
spaces that
población,
meet
¿no?
the
El tema
specific
de que
needs of
haya
this group.
guarderías, hay
Daycare
pocas, pero cada vez
centers,
hay más en
there
América
are very
Latina,
few, but a
comunidades
growing number,
que permiten a los hijos
communities
de
that
nuestras
allow
usuarias
the children of
estar
our
y
users
pasar tiempo con
to
ellas,
be there,
¿no?
spend time
Que ya
there,
no sea este
that
aislamiento,
there not
el
be a
generar asesoría
perpetuation of
legal, mucho del
isolation.
abandono del
Also,
tratamiento
legal
en
counseling,
nuestras
a lot of the
comunidades es
abandonment
la amenaza
in
por
our
parte de la familia o de las
communities
parejas
are
para quitarles a
due
los
to
hijos
threats
y
from the
seguir
family
viendo como
or
únicas
the
proveedoras
partner
de
to take away the
seguridad
custody
y
of their
de cuidado
children
a la
and
familia y a los hijos, a
them
las
being the
mujeres, ¿no? Entonces también
only
una de las
caretakers
cosas que
for the
hacemos
children
mucho
in
es
the
la
families.
educación a
So
familiares y a
we
personas
also
significativas que
carry out
acompañan a
psychoeducation for
los
family members
usuarios, ¿no? Como
and
una
significant
manera
others
de
who care
ir
for the
bajando o
children
eliminando estas barreras de acceso.
of these women
Algunas
to do away with this
implicaciones de los derechos humanos
frequent
y
barrier.
qué entendemos nosotros
There
como
are
posibles
implications for human
soluciones
rights and
para
what we
mejorar el
understand to be
acceso a
possible solutions to
tratamiento
improve access to
a
treatment
población
for
de
the
mujeres LGBTQI+, pues
LGBTQ
negar el acceso a tratamientos adecuados para el consumo de
plus
sustancias
women,
y salud mental a esta
such
comunidad,
as denying
recordarles que
access
constituye
to
una
proper treatment
violación
for
a sus derechos humanos, ¿no?
drug
No es solamente
use and mental health
que
in the
queremos
community,
generarlo, sino que
make it
recordar
clear that this is a
que es una
violation of
violación
human
a los
rights.
derechos humanos,
We want
que
to
haya
remind people of that.
políticas de salud que sean incluyentes.
Another
Para
implication
darles
is
un
that
ejemplo muy
there's a
rápido,
need for
en México, la
to do away with
norma que nos rige a las comunidades
excluding healthcare
terapéuticas o a las
policies. For
clínicas de
example, the legislation in
rehabilitación en
Mexico
temas de adicciones
governing
no nombra en ningún
rehabilitation
momento
centers and other
en
drug
esa
services
norma a la
never
comunidad
mentions
transgénero,
the
comunidad LGTBI
transgender or
en ningún sentido. Por lo tanto, las clínicas
LGBTIQ
nos
community.
encontramos todo el
So
tiempo
clinics are
con
always coming up against
decidir si seguimos la
the
norma o la
decision
incumplimos
to
con tal
follow
de
regulations or violate
poder
regulations
ingresar
in order
a
to admit
personas con estas características, ¿no?
people of these
Entonces, creo que
characteristics.
esta es una de las cosas muy
So
importantes
that's one
que
of the
tenemos
most
que hacer las
important
organizaciones y que ya
factors
hacemos, ¿no?
of
Desde
our
estas redes
reality
en las que participamos
that we
para
see
generar cambios
throughout the
en
networks where
políticas
we
públicas.
are participating.
El tratamiento no centrado exclusivamente
Also,
en el
that
consumo de
the treatment that
sustancias,
is
como ya
not
lo dije,
exclusively
y
focused
evidentemente
on
la capacitación y
substance use, also on trauma and
es una mirada
violence,
como muy,
and
muy
training
rápida
and
y general
sensitization of
de
healthcare
básicamente que estoy
personnel.
siendo
So this is a
muy,
very
muy
quick view
concreta por el
of the
tiempo, pero
situation.
bueno,
Due to time
queríamos
limitations, I can't be too specific,
desde
but we wanted
Río, desde
from
Tonali,
Riyadh and
pues
from
dar esta visión
my
desde
organization,
con
Tanali,
lo que nos encontramos en el día a
to
día
give you
las
an idea of what we
organizaciones
face in our
en el
day-to-day work
tratamiento con
as
personas.
organizations working
Muchísimas
in
gracias
the treatment
por
for
la atención.
drug use for
Muchísimas
the
gracias por tu presentación
LGBTIQ plus
y por
community.
todos los temas también
Thank
que
you
seguimos poniendo sobre la mesa,
for
¿no? A lo
that,
largo de estas
Chochtil,
presentaciones que han
and
pasado.
all of the
Y uno de
other
los términos que has
realities
comentado
that
es
we're
el tema
learning
de la
about
falta de
today.
asesoría jurídica y de
We
ayuda
have heard
jurídica a
in your
las
presentation about the
comunidades
lack of legal
vulnerables, o
counseling
sea que va
for this
perfecto.
and other vulnerable communities.
Ahora
So
voy a cambiar
this
de lengua
fits
because our next
perfectly.
panelist we are honored to have Domingos Christian with us today. Christian Domingos is program manager and advocate at AXI, Indonesia. So good night to you. It's quite late there. Christian has an extensive experience in assisting litigation and non-litigation cases involving marginalized groups, including people who use drugs, LGBTQ+ individuals, and sex workers. He actively advocates against the death penalty and is involved in various civil society legal coalitions focused on penal code reform and judiciary oversight. The presentation of Christian Domingos today is the urgent situation of women and trans women who use drugs in the drug policy in Indonesia. Thank you very much for joining us today. It's a huge privilege, and the floor is yours.
Thank you, Isela, for the introduction. So hello, everyone. So today I'm delighted to presenting and sharing the news about the situations and needs of cisgender women and the transgender woman who is trapped in Indonesia, of course. So I'm working with AXI. AXI is a non-profit organization. We are focusing on advocacy and campaign, providing community legal-based assistance to the vulnerable groups, and also who's seeking justice. We are also working closely with people who use drugs, of course, women, youth, and sexual minority group, LGBTIQ+, who use drugs as well. So today, I would like to share about our anecdotal reports recently that we already compiled in the early years. We are work closely and collaborations with Women Voice, our sister organizations based in Jakarta and Bogor. We collaborations and we make it the rapid assessments for the cisgender women and also the transgender women. So for the introductions, we realized the global war on drugs is still near us, and it also occurs in Indonesia and occurs everywhere across the globe. And we believe that the war on drugs is fraught with racist, sexist, judgmentally many women based on the heterosexual norms, and also this proportionately targets women and other species, young people, and the poor woman. And the woman refers to this activity. This framework is not also including transgender women and those with other gender identity. But we also realize in the other context, the international context, we know that with the several progressive recommendations to the decision maker, to the governments, with the overarching aim of moving away from the punitive paradigm that has guided global drugs control, including the need to improve risk reduction, the treatment services and militarizations, the death penalty, decriminalize drug use and possessions, and ensure alternative to criminalizations. And it also recommends many stakeholders to taking control of illicit drug market through responsible regulations and to eliminate the profit of illicit trafficking, crime, and violence. So the current situations in Indonesia, we are under revisions of our drug law. So we starting from that, and we believe that under the current law, we know that many punitive targeting peoples in Indonesia, also with women and also the transgender persons in Indonesia. That's why we believe that we need to collect and assess the situations of need of cisgender women and transgender women who use drugs to can be heard, can be recommendations to the government. So that's why this anecdotal report is happens. So this is the objective that we understand the needs of. We want to collect the understand of the needs of the woman and transgender woman, and we need to inform the advocacy and policy reform to the drug policy in Indonesia. So our research is involving 54 respondents comprising women and transgender women. Women is 61% and the 39% of the respondents is transgender women. We collecting from 13 provinces across Indonesia with the most of 70% from Java. And the most respondents were age 31 under 40 years or the 48 of the respondents, and followed by those over 40 years old. And we also kept the educational background varied, with the majority having completed high school or associate level degrees. And for the employment sector included, most of them worked in the NGO work level. The 70% work as a sex worker, and the homemaking is the percent, and indicating the blend of formal and informal work environments. And despite financial insecurity, 26% reported no income, and 83% have active health insurance, highlighting the role of the health care support. So from the rapid assessment, we realized that the majority had not used drugs in the past month and not have injected drugs during this period. And however, 30% had a history injecting drugs, and 30% had experienced an overdose at some point in their life. At the most common drugs used in the previous months, all respondents were amphetamine, ecstasy, marijuana, synthetic tobacco, and alcohol. And we also realized a significant proportion of respondents, 0%, had used multiple substances simultaneously in the past. We also get a fruitful data about the sexual risk behavior. We also notable on it, with the 42% of sexuality active respondents reporting more than one partner in the past 3 months. So we also capture the HIV testing rate high, with the 70% knowing their HIV status, and 80% of those being open about it with the partner and or the family members. The other key findings that we Fruitberg collects and learn it's about the legal issues that concerning 41% of responding had to face legal issues related to drug use. Among those, 24% reported experiencing various forms of abuse during legal proceeding, including physical, psychological, sexual, and economic violence, such as demand for bribes ranging from 3 million under 50 million rupiahs in exchange to reduce charges. We also know that the legal knowledge was limited, with only 37% aware of their rights as a suspect of or defendants. So we know the access to legal support was very only limited. Only 70% had a legal representations during their legal encounter, and further exacerbating with the vulnerability. The other key finding that we're collecting from the data is about the service needed, that the respondents we collecting identify several critical service gap, including access to health, counseling, and legal services, that only 85% requested the legal support related where they are caught or they have to face the legal procedures in their case. The health services, 70% mental health support and drug rehabilitation access, they were highly demand, and also access to PrEP for the HIV is demanding almost for 48% from the respondents. And also the counseling, the most needed type of counseling including legal rights, 85%, mental health counseling with the support of gender-based violence, also with the counseling method, it's 55%. And the others response need, they realize that they need the shelter facilities. So they urge for the three findings that we collecting from the data. So we are in the conclusion that we finding underscore the unique challenges faced by cisgender and trans women who use drugs in Indonesia, in particularly regarding stigma, legal exploitations, and healthcare access. The respondent also expressed strong desire for interest legal support, mental health services, and also the shelter tailored to their needs. So the recommendations, we also have the 3 recommendations. One is we encourage the advocate for gender-sensitive narcotics drugs policy, we increasing the access to mental health and mental services, and strengthening the shelter and the legal aid. Thank you so much for having me.
Thank you so much for being with us, and I'm pretty sure we will.
Thank you so much.
Terima kasih. Thank you so much, and I'm pretty sure that there's going to be a lot of questions around this topic, because we have a little bit of insight and thoughts on the chat box. So again, feel free to put your questions on the Q&A box, and maybe we will not able, because restriction of time, to address all of them, but we can send them to the panelists, and maybe you can answer this afterward. So thank you very much, Chris. So last but not least, we have Marketa Doletzi. Marketa Doletzi, let me just 1 minute. I'm going to share your presentation. Is that okay? I'm going to share the screen. Okay, awesome. So Marketa presentation title is Implementing Intersectionality and LGBTIQ plus community across the continuum of care, prevention, treatment, and harm reduction. She's a Czech social worker who serves as the head of treatment programs at the NGO Magdalena, which focuses on addiction prevention and treatment. For 26 years, Magdalena has provided prevention services, harm reduction, and treatment in the central Bohemia region and across the Czech Republic. Markéta has an extensive expertise in mental health and addiction, having previously worked as a therapist in a re-entry program with training flats and as a case manager in mental health services. Her professional focus includes dual diagnosis, integrated approach, intersectionality, and of course, human rights. Thank you very much, Markéta, for being with us. And I'm going to share the screen. Just give me 1 minute. And let me know when you want to move slide, move forward with the slide. Okay, I hope you can see it right.
Thank you very much. Thank you very much. Hello and hi to you all. It's a big honor for me to be part of this meeting and webinar, because it's very important topic for the not only addiction services, but Czech Republic, because as I hear you from all around the world, we are not in such good shape with rights for LGBTQI plus people in Czech Republic, and we are dealing still with problems that you already solved. We don't have the situation in Czech Republic is not such good for the rights. We don't have marriage for all still. We don't have other rights that are equal and protect people with LGBTQI community. So that's a situation in Czech Republic. For just a brief introduction to be in to see our shape that we are still fighting against things that you already solved, and we struggle with these topics also in addiction services, because we don't have these people in our services. They are not entering the programs because they are not feeling safe enough, and we are not able to provide them secure space, because I'm a therapist also, and a lot of my colleagues are not able to work with people from LGBTQI because they are not skilled, and they are very homophobic, and they have a lot of stereotypes. So this is the biggest gap between clients' needs and the professionals. They are more, if these people are coming to our services in Czech Republic, they more go to outpatient centers, but these centers are crowded a lot, and even there they are not able to get correct treatment because they have a lot of obstacles they are dealing with, and they are not coming to residential services because we don't have safe space for them. And we can see on this slide that we decided to change this culture in Magdalena, because we have a treatment services, we have a prevention services at schools. We learn or teach teachers how to do prevention at schools, and we work with students on a primary and secondary schools in Central Bohemia and also in Czech Republic, and we run harm reduction services in Central Bohemia. So we have the whole complex of addiction services in Magdalena, and we decided to change our view to this topic, because we were dealing with a lot of dropouts of clients from LGBTQI community from our services, and we decided that we need to change it. So we had a conference in last year in November, was it? We have an addictions conference, and there was a speaker, Gisela Hansen, who is now running this webinar, and she was presenting intersectional approach in addiction field, and it was very inspirative for us. And she also visited our services and in Magdalena for a short time, and we were talking about bringing intersectional approach into our services to see the obstacles and try to manage the change. Then we visited with two of my colleagues. We visited Barcelona services in harm reduction, prevention, and treatment, who is oriented in or more skilled in an intersectional approach. And then we have an external consultant who is helping us with implementing intersectional approach into Magdalena services. We met Gisela last year on this conference. That's a photo is from there. So we decided to make a commitment because we feel it's very hard and serious work, and then we have to, because Magdalena is very huge organization. We have like 100 people working in the field with clients or service users, and we decided to implement it in all three sectors: prevention, treatment, and harm reduction services. So we made a work plan structure. I founded two of my colleagues who are passionate about this approach, and we prepared next steps. We made a diagnosis of our organization with intersectional lens. That wasn't the feedback wasn't so good because we've recognized a lot of obstacles, and so we organized a traineeship in Barcelona that was focused for intersectional approach, and we had a feedback with our external consultant about our travel, and we prepare next actions for being able to implement this approach into our services. So now we are here to present our journey and what we found it out since now that we have resources in our organization for this change. We have it also outside from Magdalena. We can find it in civil society. We have other organizations who can be involved. We have friends from outside that have the same feeling that we need a change. We have an experience from abroad that it is sustainable, and it's important to change our services and help our clients and also colleagues to be more skillful and to protect human rights. We have people in Magdalena who is with us, and also we have a lot of obstacles that we have to jump over. So we have to make very simple and baby steps and to build a realistic and strategic plan to be able and to be successful with this path. And we need to invest more in our people, in our professionals, to encourage them to change their minds and to involve them. So we are still on our way, and we are still optimistic. These are colleagues that we met in Barcelona, in mental services. very interesting, very inspirative. And I would like to thank you for your attention. And I'm free to share and meet you. Thank you very much.
Thank you. Thank you very much, Marketa. Thank you very much for, just making us know about the process and how long it can be to implement intersectionality approach in the services that are running during 4 years, and changing the lens can be really baby steps sometimes, little by little, but we're still on track. So, a continuación, vamos a pasar a un
And
tiempo
we will
muy
now have a
limitado
very,
de
very,
preguntas y
very brief
respuestas que
Q&A
tenemos.
session.
Vamos a tener unas 3
We
preguntas que
can
nuestros
take
panelistas
3
van a
questions,
intentar
and our
de manera
panelists
casi
will try
milagrosa, creo,
to
resumir en casi
miraculously
1 minuto sus respuestas. Es una
answer
pena.
in
Yo
just
creo que
1
vamos
minute.
a repetir este
Unfortunately, we
evento
don't have more
porque nos
time. We'll
queda
have to
mucho
repeat
sobre lo
this
que
webinar
conversar
because there's so much left to
y
talk
esta
about
sabiduría, ¿no? que
and so much
estamos viendo
wisdom
hoy en pantalla.
to share,
Entonces,
as we've seen
vamos a
today
pasar
on
a
screen.
la
So
primera pregunta
let's take
que
our
va
first
un poco
question,
dedicada a Laia y
which
a
goes out
Domingos,
to
Cristian.
Laia and Domingos.
Si podéis decir
Christian,
alguna cosita, si queréis agregar
if you
algo
could
durante
speak
1
to
minuto
this.
o algo así. So I'm going
The
to read
question
it in English.
is,
What specific changes can be made to drug policies to address better the needs of LGBTQ people, individuals facing drug-related issues, and gender-based violence, and how can we ensure their perspective are included in these revisions? I know it's super challenging to answer these in just 1 minute, and it's a huge effort, but what do you think about this? Laia or Chris, want to go first?
Un par de cosas muy breves. Una en la línea de lo que decía
just a few
Marketa
brief
del
ideas
abordaje
along the lines of
interseccional.
what
Me parece
Marketa said with the
superinteresante, más
intersectional
allá
approach. It's
de
very
implementar la
interesting.
perspectiva LGTBI,
Beyond just
avanzar hacia modelos de
implementing an
servicios que sean
LGBTI
diversity
service,
friendly
that all
directamente, ¿no?
services be
Entonces,
diversity
¿cómo
friendly.
podemos integrar todas
So
las
how can we
interseccionalidades? Es una
integrate
forma
all of the
de trabajar la
intersectionalities?
cuestión
That's
de
another
las
way
violencias
to
institucionales y por
work on
parte
this
de
question of institutional
profesionales, otros
violence
usuarios, etcétera.
and improve
Un
our
tema
professional
que
services
no
for
ha salido
users.
y que aparecía en
One
los
thing that
2
has not
estudios que
come
hemos
out
leído, al
that
menos
appeared
en
in the 2
España,
studies that we did
me parece
here in
interesante revisar el
Spain,
tema de las comunidades
it'd be
terapéuticas
interesting to
porque
review
como
the idea of
modelos
therapeutic
de
communities,
servicios de drogas más
because
conservadores y más
as more
tradicionales,
conservative
parece
drug
que son los que levantan
care
más
centers,
resistencias
they're the ones
o
that have
los
the most
que
resistance
plantean más barreras de
or that
acceso y
have the
permanencia
most
a las personas
barriers
LGTBI y
to
también más
LGBTIQ
revictimizaciones.
people
Y
staying
en el
there
caso de las personas más
and
vulnerabilizadas y
being
con
in
menos
them. And
recursos,
for the more
solo pueden
vulnerable
acceder
people
a
with
las
the
menos
least
profesionalizadas, que
resources,
son
they can
normalmente
only
de
access
tipo
the least
religioso,
professional
y
sort of
allí
groups, usually like
se
religious
expone
groups.
a las mujeres y
And there
personas
they
LGTBI a
are
mucha violencia.
exposed to a
Entonces,
lot
creo
of
que es
violence.
algo revisable.
LGBTQI people
También para los
are, so we
recursos
need
de
to look at
reducción de
that.
daños que
And also
continúan siendo
for the
percibidos como
harm
espacios muy
reduction
inseguros,
resources, which are
tanto
also
para mujeres como
seen as
personas
very
LGTBI.
unsafe environments for
Muchas gracias, Laia.
LGBTIQ
Chris?
women and men. Chris.
Yeah, thank you. So a little adding about the situations that we know the shrinking civic space is really near us. Especially, it's very hard if we talking about drugs. We are talking about the LGBTIQ in Indonesia. So that's why how we try to bring the voices and how the new perspective is challenges in Indonesia. That's why for a couple of years we try to conducting the activism activity in Indonesia. We call it Art Speak Justice, who are the annual events in Indonesia helped by AXI, and we try to bring another horizon as perspective from people who use drugs, LGBT people, and also youth and the women who use drugs also. We implementing the arts, sculpture, poem, the poetry, the about their activity daily in the photo stories, events, and they are always using dancing. We always using painting to describing, and we have the public events. We glad that so many people attended, including the government itself, including the lawmakers, including many military police, of course, attending, and they lively see the others' perspective of the minority groups who takes part of the event. So the values driven we try to collect is we try to bring the narrative, the presence, and the real of the minority groups to be love each others and know each others. And we believe that many activity, many people comes, and we believe that they will support the presence and rights of many minority groups in Indonesia, for instance. Thank you so much.
Thank you. Thank you very much for this. So the next question is to Edward and Marqueta, if you are up to. It's about cultural competence training. You were mentioning this in your presentation as well. What practical steps can organizations take to improve cultural competence among services provided for LGBTQ+ individuals? If you can please share some examples of successful or not successful initiatives that you can share with us. Edward, if you want to go first.
Sure. Just real quickly, I think at some point, I'm just in a fortunate position because I'm the CEO of my organization. So I just did it. I told everybody this is what we're going to do. So we did some research, looking at best practices, developed our diversity training, made sure that we had a statement about how the organization represents diversity and the inclusion process, our statement on diversity and inclusion. And then we also just focus on training staff and then working with the clients, because it becomes a bit of a clinical issue, because clients have a lot of reaction, especially in a residential service setting, when somebody chooses their gender. We make sure that we put people with people that they feel comfortable with. But a lot of the people who have some of their biggest concerns, we often find in the end, after they've gone through treatment, they often admit that their concerns were unwarranted, because they're all trying to get in and focus on getting recovery. And as I talked about access and retention, if you don't break down those barriers for treatment, the first moment that you connect with somebody, that you have to engage with them. And if you don't engage with them, you could lose them, period. And they could wind up back out on the streets and dead, because they'll accept that as that they're already feel that they're not worthy. They already feel the stigma from society, not only with addiction, but because of their sexual issues and their presentation of themselves. Often people are very, so that's why we make sure at that moment of intake, when we connect with them, that we make them feel comfortable, accepted. And we have a philosophy at Odyssey House that we're going to love the clients till they love themselves. And so we focus on trying to implement that every day in the work that we do.
Thank you very much. Thank you. Marqueta, do you want to add something?
Oh, this is very inspiring. We are just in a process. So I think it's the most important thing that we need to include in every service, not only in addiction services. So we are able to love all people who are we working with. But I see most of the obstacles with my colleagues and professionals, and we are looking how to make them easier to be prepared for the change. So this is, I think that's the miracle of success, to make them change and they don't know that they changed. And this is the most important thing. And I hope we will be able to, for all of the services, not only check out all around the world, to improve this approach.
Thank you very much. Thank you very much for these thoughts. And our last question for Sotil y Cristiana. It's a tricky one. I know we have 1 minute left and it's very difficult, but maybe you can sum up a little bit. How can civil society organization enhance collaboration with governmental bodies to improve access to health services for LGBT communities? What joint advocacy strategies can be implemented to push for policy changes? I know it's a difficult question in a short time. Sotil, si tú quieres, primero.
Bueno, creo que desde lo que nosotros tenemos como experiencia,
what our experience has shown us is basically,
como en resumen, 2 puntos.
to sum it up
Estos
into
creo que estos
things.
espacios de conversar, de hablar,
Spaces
de
of
escuchar,
dialogue,
bueno, a mí me hacen aprender muchísimo, a mí y a todo nuestro equipo y a las
communication
organizaciones.
enable me to
Vamos
learn a lot.
inspirándonos,
And the
pues,
same
de
is true
Abarqueta y
for
vamos
all our
viendo
team, all our
estas buenas
organization.
prácticas
We get
en
inspiration.
otros lugares
We
y
learn
creo
about
que
best practices
desde
from
ahí
other
es que vamos
places.
generando. Y
And that's
otro
how we can
punto,
generate. And another
no
thing,
digo que sean los únicos, pero
it's
a
not that we're the only
manera
ones to
de
do this,
resumen,
but to
creo
sum
que
it
el
up,
trabajar en red. Las
working in a
organizaciones
network,
de la
organizations
de sociedad civil
of civil
vivimos mucha
society,
soledad, ¿no? Porque
oftentimes we're on our
no
own.
nos sentimos a veces como sustentadas por
We
otras
don't feel the support
instituciones
of other
gubernamentales
institutions,
o de otro
governmental
tipo.
or
Entonces
other
creo que el
sorts of
trabajo en red es
institutions. So
fundamental,
working
¿no?
as a
De uno
network is
muere el
fundamental.
intento y creo que
If not, you can die
el
trying.
apoyo, el
And
intercambio
with
como
support,
dije,
with
buenas prácticas,
the
de
exchange of
información,
best
de
practices, of
servicios. Entonces,
information,
para mí serían como
services,
esos
and
dos
so
grandes
on.
puntos,
Those
trabajo
would be
en
the
red
two main answers.
y este tipo de
Working
espacios.
as a network and having
Muchas
the
gracias,
proper
Titi.
spaces
Cristiana,
enabled
¿quieres agregar alguna
for
cosa?
Sí,
clear communication.
yes,
And
very
Christiana?
quickly, I think as work in a track field is very relevant to build these allyship relationships with queer collectives, organizations working with LGBTQ people, and also those who are working more with these communities. For example, the services, STI and HIV screening services, sexual health, and so on, who are work with men who have men, sex workers and so on, because they, tend to contact more with LGBTQ people, specific groups of LGBTQ people community who use drugs. So yeah, network among all of us and to promote this collective learning process and mutual learning between peers working in different spheres of the community-based intervention. And then another dimension is because these are overlooked the groups. I would say this network can allow us to do this kind of community-based monitoring process to identify, specific trends, needs, priorities, and to address them in our intervention on one level, and on the other level, to those deciding truck policies in Portugal, for example, and promoting this policy dialogue in order to, make these priorities very visible also for them, and trying to influence, the way the public funding is designed, and like the options and so on. So I would say this.
Muchas gracias, Cristiana. Yo creo que nos
Thank you,
quedamos con
Cristiana,
muchas
and
ganas
I
de
think
escucharos
we would love
horas.
to listen to you
Y
for
sería
hours.
maravilloso.
That would be wonderful.
Para ir cerrando este
But
seminario,
just to
me gustaría saber
finish
si
up,
a alguna de las personas panelistas le gustaría
would
dar
any of the
como
panelists like
alguna
to
frase o alguna
give us
llamada a
a
la
parting
acción. Es decir, ahora
phrase
tenemos
or
este minuto de
statement?
margen, si a alguien le
We have
apetece decir
just
algo.
1 minute if anyone would like to
Las personas por el chat han
have the last
estado
word.
inmensamente agradecidas. Hay muchas
People in the
preguntas
chat have been very
muy
grateful
específicas que os vamos a hacer
with a
llegar a
lot
los
of very
panelistas.
specific questions that we
Entonces,
will
por favor,
distribute
si
out
alguien
to our
quiere decir
panelists.
alguna
If anyone
última
would like
idea que
to
se haya quedado
have the
en el
last word
tintero.
or one thing that we haven't been able to cover.
Muy rápido, quizá
Very
decir que en
quickly,
los próximos webinar que vas a organizar
say that's
sería
for your next
importante tener
webinar.
también las personas con
It's
experiencia,
also
con
important
experiencias de contacto con servicio, con lived experiences,
to have people
también para
who have
traer sus
lived
perspectivas y
experience to
enseñarlas
get
también.
their experience and learn from
Maravilloso,
them.
gracias
Wonderful.
por la
Thank you for
aportación.
that.
No sé si hay alguien más.
Anyone else?
Bueno, si no hay ningún comentario
Okay,
más,
if no one
pues
else
vamos
wants
a
to
ir
take the
cerrando
floor,
y este
we
seminario ha
will
reafirmado
hereby
una verdad esencial,
close
que
the
abordar los
webinar,
desafíos del uso de sustancias desde una
and
perspectiva de
remembering
derechos
how important
humanos
it is
no se trata
to
solo de brindar apoyo,
approach
sino de
substance abuse
afirmar la
and
dignidad, la
use
igualdad y el
services
derecho a
with
prosperar de las
gender
personas
and sexual
y
identity in
las
mind
comunidades
to
desde un
protect
enfoque
the rights of all
interseccional.
people and all
Os
communities from the
animamos a
intersectional
todas
standpoint.
y
We
a
encourage all
todos
of you
a llevar los conocimientos y
to
perspectivas
take
compartidas hoy a
these
sus propias comunidades, a su
learnings into your
trabajo,
own
pero
communities
también a sus
and your
vidas.
own
Y que
work
juntas
and
podemos
your
seguir
own
abogando por
lives
políticas y
to
prácticas que no
continue
solo lleven a
working
quienes lo
for
necesitan,
policies and
sino que también
practices that
garanticen que
reach
cada persona tenga
not
el
just those who
derecho
need it now,
a
but
un
that
futuro libre de
guarantee
estigma,
all of our
libre
rights
de
to
discriminación y sobre
overcome
todo libre de
these
violencias.
barriers
Por último,
and
yo no quiero
live in a
perder la
society
oportunidad
free
de
from
agradecer
stigma,
nuevamente a
discrimination,
nuestras
and violence.
ponentes. Ha
So once
sido
again,
un
thanks to
absoluto
all our
lujo,
panelists.
un
It's been a
placer.
true privilege
Agradecemos
to
el tiempo dedicado a la
listen to you this
organización, a
afternoon.
la preparación de las
Thanks to
presentaciones,
the
el compartir su
organizers. Thanks
conocimiento
for your
para
time
crear
putting
estas
together your
acciones colectivas.
presentations
Agradecer
and
también a
sharing your
Patrick,
knowledge.
nuestro traductor,
Thanks
que
to
lo
Patrick,
hacemos
our
ir corriendo del
translator,
castellano al inglés.
going back and forth between
Y al
Spanish and
equipo
English.
técnico
Thank you
de
for
Dianova,
listening.
Gerard y a Pierre, a cada uno de
And
ustedes por
also
formar parte
all
de
of
este
our
diálogo tan
technical
importante.
team to make
Cerramos
this
este
webinar
encuentro con
possible.
una comprensión más profunda de los
We
temas,
will
pero con un compromiso
stay
renovado para
in
la acción y
touch
la transformación.
with our
Y hasta que
commitment
nos
to
volvamos a
learn
encontrar,
and transform.
les pedimos que sigan
And until
conectadas
next time,
y
stay
conectados con
connected
los próximos eventos que vamos a organizar a lo largo
to
del
our
2024,
information channels
porque
to
yo creo
learn
que
more
esta
about our
conversación que hemos
upcoming
tenido va a
events.
ser la primera de
The
muchas,
conversation that
focalizando
we've had today will be the
en
first of
esta
many
cuestión. Así que muchas gracias por
focusing
estar
on
hoy
this subject
y
matter.
que
So
tengan un
thanks for being here
maravilloso
today,
día.
and we wish you a
Gracias.
great rest of the day. Thank you and goodbye.